Hello, everybody. Can you hear me? Yeah. Uh, first of all, I would like to thank you for the opportunity of sharing this presentation with you. I will share you some information on DC4EU project and participation of NFZ, National Health Fund, in this project. DC4EU is co-funded by the European Union Digital Europe program. It involves 22 member states, plus Norway, Ukraine, and Switzerland. Also, 99 public and private organizations and entities with significant expertise in the digital identity. So we are a multinational consortium led by our colleagues from Spain, by the Spanish Ministry of Economic Affairs and Digital Transformation. And the project has started on the 1st of April 2023 and will run until July this year. In my presentation, I will mainly concentrate on business side of the project, but I will also try to give you technical background. The project is one of the European projects that will help member states and other organizations to prepare for the entry into force eIDAS 2.2. eIDAS 2 it is a European digital identity regulation, and it stands for Electronic Identification, Authentication, and Trust Services. eIDAS 2 provides a standardized framework for digital identities, electronic transaction, and trust services in digital interaction across Europe. A key component of eIDAS 2 is the introduction of European Digital Identity Wallet. Digital wallet will provide a safe digital identification for everyone in Europe. Every member state will provide a wallet to its citizens to allow them to prove their identification, to allow to prove who they are, and to store and share their documents. Among the documents that will be available in wallet are those relating to education and social security, and these documents are the focus of our project. DC4EU concentrates on education and social security. The aim is to test the functionality of the wallet in education sector. And here the focus is put on educational credentials and professional qualifications, and in the field of social security. And in this field, we have two main documents, PDA1 and European Health Insurance Card. The main objective is to test interoperability and scalability in the national domain and multiple cross-border context. The results of the test will help to build digital wallet, but also will provide feedback to European Commission and to other member states. The project includes 9 work packages. As the NFZ, we are part of package number 6, the social security domains. And here I would like to add a few words about the role of NFZ in the structure of the coordination of the social security system. Our organization is responsible for benefits in kind, and International Affairs Department at NFZ headquarters acts as the liaison body for the benefits in kind for the social security coordination, and also as national contact point for the patient's rights in cross-border healthcare. NFZ is also responsible for issuing European Health Insurance Card in Poland. Package number 6 is led by our colleagues from Austria, and main focus is put on social security field by exploring the issuance and validation of digital credential for social security documents. And the scope of work includes onboarding proceedings, identifying business requirements, implementing interfaces for credential issuers, testing, and evaluation of process. The main focus is to ensure that digital wallet will be used by the citizens of all member states and to allow them to use their social documents smoothly across different countries of Europe. The project's main objective is to also to underline that citizens must have full control of their personal data and to promote a user-centered approach to digital identity. And as I mentioned before, we have two documents. PDA1, it's confirmation of applicable legislation, and statistics show more than 2 million A1 documents issued every year across Europe. eHIC card provides access to medically necessary state-provided healthcare during a temporary stay in another member state. And currently around 240 million European citizens hold an eHIC card. Our work as the NFZ has been concentrating on the eHIC card, and our work has focused on developing the use cases for the eHIC, defining the data model and the process involved in issuing, using, and also revocation of eHIC, and testing the solution. At the beginning of this year, we have conducted a test at NFZ. We have decided to divide the test into 3 phases: liaison body, so International Affairs Department, NFZ headquarters, and regional branches. We have carried out more than 1,000 tests with the help of 551 participants, and we have received very encouraging and very valuable feedback. As evidence, some pictures taken at NFZ headquarters and International Affairs Department. What is the eHIC card and why it is so important? eHIC card is issued for free by the national health insurance provider and provides an access to medically necessary state-provided healthcare during a temporary stay in another member state. eHIC provides medically necessary treatment, but does not cover cost of planned medical treatment. Treatment should be provided under the same conditions and at the same cost as for people insured in the country of stay. It is important to remember that eHIC does not guarantee a free service. It's because each country have got different healthcare system, and sometimes participation in costs may apply. So eHIC helps to avoid or significantly reduce the cost of medically necessary treatment during a temporary stay in another member state. Currently, eHIC card is issued in the form of a plastic card in a format that follows the guidelines of the Administrative Commission set out in decision S2. The card is easily recognizable by insured person and by healthcare providers. In the future, hopefully, eHIC will be part of the digital wallet. Okay, let's try to reflect on whether the DC4EU project has an impact on the EU global health. DC helps establish a trust framework and data standards. It also responds to the increasing mobility of citizens within Europe and to organizational and technical challenges, will improve and will help access to medical care for people in cross-border situation, ensure a unified approach to identification and verification of entitlement. Definitely will improve emergency response by providing fast access to credentials. Enables real-time verification of entitlement, speed up the verification process, and definitely will speed up the process of updating information. And by real-time verification, it will help to reduce the risk of fraud and error. Will help reimbursement process between countries. Portable documents and portable digital credentials will give equal access to healthcare for citizens across Europe. Digital educational credentials and professional qualifications will support the mobility of health workforce. And digital A1 document will support workers' rights to free movement within Europe. The DC4EU project and the EU Global Health Impact may seem different at first. One focuses on digital identity and digital credentials, and the other on global health. But I think there are some important strategic synergies between these two, especially when it comes to digital transformation, data interoperability, and cross-border healthcare in Europe. Oh, yeah. So thank you very much.